closed everything.
Pacing wire is made of.
Okay.
Next question.
Okay, first, what is
start कर दिया.
you are told to remove the pacing wire. You have come to the bedside of the patient. Okay, you know that you have to remove the pacing wire. How do you know?
Patient vitals are stable.
Patient vitals are
heartbeat,
stable. Then
Post
Speak
op.
louder.
Not
Okay, and
fluctuating.
clearer.
Like ideally, we keep a pacing wire so that it stays in sinus rhythm. So we take an ECG and make sure at least for 24 hours he is stable post-op day 3 or 4.
I don't care. It is post-op day 10. Now you are removing at post-op day 10. How do you know that you can remove the pacing wire? You can know that you can remove the pacing wire when you know that you don't need it. How will you know that you don't need a pacing wire?
Patient
You have to know what a pacing wire does. Whatever the pacing wire does, if it is not needed in that patient, you can remove the pacing wire. What does a pacing wire do?
In case of
when the conduction pathway gets affected during surgery.
Okay,
so
pacing
this
wire
drug-
cannot reconstruct.
basically any
the
heart
conduction.
block is there. If heart
Heart
block
block.
is there, we can add
Okay,
pacing.
so I'll tell you. Pacing wire can pace the heart, can send impulses to the heart. Okay, that is basically what it can do. If there is a heart block at AV level, you can use RV pacing wire and pace the ventricle directly. Okay, if there is no conduction block at AV node, you can use the RA pacing wire and pace the ventricle from atria. That is the best way of pacing. Atrial pacing is the best way of pacing. Okay, you pace the atria, the conduction will this impulse will be generated in atria, it will travel down the usual pathway. Sinus rhythm is the best rhythm always. Okay, now you have to see that first of all patient has no arrhythmia. Okay, if patient has no arrhythmia, then you can be sure that patient will not require pacing. What is the other thing that you have to see? Patient can be in AF and you can remove pacing wire sometimes. And patient can be in sinus and you cannot remove pacing wire. What is the patient is in sinus? When will I avoid removing pacing wire?
patient not able to carry his day-to-day activities or like
No.
If we suspect that he may land in.
If the reversible causes of arrhythmias are still present in the patient. You understand? If there are causes which are reversible and they are not yet corrected and he can still have arrhythmia, then you should not remove the pacing wire.
electrolyte
Okay.
abnormalities.
Electrolyte abnormalities, okay. Electrolyte abnormalities can be corrected easily. More importantly, you have to see saturation and oxygenation of the patient. If that is adequate, he will not go into hypoxia. You have to see the temperature of the patient. He is not getting any fevers. Then that reversible cause is also eliminated. Then he is not likely to go into AF or anything. In that case, you can remove. And the third most important indication is that your senior has told you to remove. Don't question a lot of times unless you find a gross problem. Sometimes you will think that I should not remove pacing wire, but someone who is more experienced than you, he is telling you that he will not need. You trust them. At least in the first and second, in the first year you trust them, and in the second year also you trust them. Third year onwards you can question them.
Question. Okay.
Okay.
Done.
If someone is telling you remove the pacing wire, if you think that he is having these and these problems, but your senior knows that it will not cause anything because he is seeing the 10 other things which you are not able to see. Okay. So basically oxygenation is good, rhythm is good, heart rate is good, no arrhythmia is there, you can remove. Okay.
For all this, you have to check ECG first. Check the
ECG.
vitals first.
Okay. Put the monitor bedside.
Before removing, you check the INR first. INR is 8. You are removing.
Bleed.
It is blunder. Okay.
Nurses will never tell you in case of high INR, but
Saturation is 80.
Hmm.
Patient is in arrhythmia. You will remove.
No.
No, sir.
Post AVR. Patient vented to block. Pacing wires are there. Question.
Not remove.
You won't remove. Patient is VSD. Complete heart block.
No.
Pacing is on.
Not remove.
Not remove. Patient already is in permanent pacemaker with a epicardial pacing wire. Permanent pacemaker already in.
We can remove them.
We can remove unless and until other contraindications are not there. Okay, sir.
INR is high, you can't remove. Okay. Most commonly, you will never be told in case of an abnormal INR.
Most
to
common
remove.
complication of CABG is post-operatively
Bleed.
arrhythmia लाइट bleeding तो reacts किया कल इसलिए याद है arrhythmia is atrial fibrillation. Okay. मोस्ट कॉमन से इधर भी नहीं जा रहा है नेट पीजी के बाद. First sterilize. So before pulling out the pacing wire, speak to the consent team whether to pull out or
Cut.
to cut. Okay. In our unit, we will cut the pacing wire.
Here also you have to see this is a simple interrupted suture. Whenever you remove the suture, you have to see the three limbs. You see the three limbs, I see the three limbs. Then only you have to remove. Otherwise, you have to search for the limbs. Sometimes something will be in the skin tunnel. You can just manipulate the skin around and something will come out.
Simon, आनो पण काढ दे. आपण काढ दे.
Now you have to untie this also. Okay. In cutting, you can avoid untying. You can just cut it and just hold it above the knot. Okay. Tell the patient to take deep breaths in and out. Deep breaths in and out.
நல்லா மூச்சு இழுத்து விடுங்க, நல்லா மூச்சு இழுக்கணும்.
And then when he is taking deep breaths in, you should hold it firmly so that the skin is moving around it. Okay, pacing wire is also moving with the skin, then there is no point. It should be such that the skin is coming up and down of the wire. We always leave some loose end when sir will be putting pacing wire in. He will take a bite on myocardium and leave a loop inside, some small loose end inside, so that when you are, even if you are tugging, okay,
It doesn't come out.
yeah, it won't come out. There will be no tension on the myocardium. Okay.
இப்போ வெயிட் பண்ணுங்க. இப்போ ரிமூவ் பண்றல.
Take deep
நல்லா
breaths in
மூச்சு
and
இழுங்க,
out.
பொறுமையா நல்லா இழுத்துங்க,
In
விடுங்க.
and out, in and out. Don't hold
மூச்சு
it.
இழுத்து விடுங்க, பிடிக்க தேவையில்லை.
You don't see it, but I can feel it coming up and down. Okay. And in deep inspiration, when the patient is in maximal inspiration, I will cut it. Then after removing, just see if there is anything in. Mostly it will go in through the tunnel.
Sir, we cut in inspiration or expiration basically?
Deep inspiration.
एक्सपीरेशन पे वो ज़्यादा बाहर नहीं आ जाएगी?
अरे हम
Expiration में कम बोल रहे हैं.
डीप इंस्पिरेशन
वो तो inspiration होता है.
इंस्पिरेशन में चेस्ट ऊपर आया, मैक्सिमल इंस्पिरेशन पे, ओके, इफ यू कट, व्हाटएवर इज इन विल गो, व्हाटएवर इज आउट विल गो इन.
अंदर जाएगा.
With the chest wall it will go in. Okay.
What is the complication you are thinking about if you don't remove properly?
So, any accumulation around the part can be tamponade.
वो तो post removal.
Tamponade तो बहुत लेट होता है.
Post removal.
Sir, it will get
Tamponade is the first thing you have to be very careful. Okay. Next, chronic thing. You are not removing. There is a tract.
sinus tract.
So it can go up till heart. You see.
Okay.
It can go up till heart. So one of the morbid condition.
நல்லா மூச்சு இழுங்க, மூச்சு இழுத்து விடுங்க, மூச்சு இழுத்து விடுங்க.
So what to do in case of removal?
Speak louder, Mega.
So what to do in case of removal, sir, rather than cutting?
Removal. It is more simpler then.
It's simple.
You just
Take
have to
a
slowly
roll.
pull out.
No, you pull the.
Yeah, that is there.
Sir, it's inside it's wrapped around, but basically it's in right atria ventricle. Or?
On the epicardium. Okay. These are all epicardial leads. How many pacing are there? One is epicardial, one more is endocardial pacing, जो हम इसमें करते हैं ना, resynchronization therapy में.
CRTD.
That is or endocardial. What are the complications of endocardial pacing? वो पढ़ना है.
Hemorrhage,
Homework है. All that you have to do homework.
Switch off.
कर देना.